So chapter 10 is just looking at Australia's health system. It is the second last chapter in the book, so we're almost done with the book. And it is the beginning of outcome 2, unit 2 for health and human. So we're only going to be covering 10.2 spread today. So 10.2 focuses on Medicare and the pharmaceutical benefit scheme. And these are two topics which you will repeat again in unit 3. So in unit 3, health and human, you are going to repeat these topics again. So obviously, if you have a good understanding of them from unit 2, it will make your life a little bit easier when you start with unit 3. So these two topics will be repeated next year. So the first thing that we're looking at is a big part of our healthcare system and a big part of what we pride ourselves on in terms of our healthcare system, in terms of why our healthcare system is so much better than other countries like America's or other countries like that, is that we have really good public healthcare. And public healthcare is what Medicare is, okay? Our public healthcare system, or the backbone of our public healthcare system, is Medicare. So without Medicare, we don't really have a public healthcare system to begin with. Medicare is what allows us to have a public healthcare system where if you are a permanent resident of this country, or you are a citizen of this country, or you were born here, you are able to access Medicare. And you would have seen your parents, carrying these Medicare cards from when you were like really small. If you were really young and you went to the doctors with your parents, you would have seen them kind of taking this card out, giving it to the receptionist. And you might have wondered what that card was. All of you are at an age where you can now actually get your own Medicare card. So maybe some of you actually have your own Medicare card as well. So a Medicare card is basically just a card that shows that you are eligible to use Medicare. Now, what does eligible mean, or what is the eligibility criteria for being able to access Medicare? Because let's say if your grandpa or your grandma from overseas comes to Australia, they can't access Medicare, because Medicare is only actually something that can be accessed, or something that's eligible for people who are Australian citizens and for people who are permanent residents. Okay, so permanent residents or Australian citizens. So if you were born here, you can obviously access Medicare. If you're a permanent resident, so you've come here to study or something and you've lived here for many years and you get your PR, then obviously, yes, you can access Medicare. Also, we have agreements with certain countries. We call them reciprocal agreements. And reciprocal agreements means that if I go to New Zealand, for example, while I'm in New Zealand, even though I'm not a New Zealand citizen, I can kind of use their medical system. And if someone from New Zealand comes here, then they can also use Medicare. They're eligible to use it, because our countries have kind of come to an agreement that both of our citizens, if they go to either one or the other's country, then they can actually use each other's healthcare systems. Okay, so those are the only 3 eligible groups that can actually access Medicare. Now, Medicare is what we call a subsidized healthcare. Okay, unlike what people think, it's not free healthcare, and I'm going to tell you why that is in another slide or two. It's subsidized healthcare. Subsidized means that it's provided at a low cost, okay? And it's provided at a cost. Sometimes you don't have to pay any extra out of your pocket. When you go to the doctors, if you go to a doctor that's bulk billed, okay? If you've ever gone to a doctor clinic and you see a sign on the front that says bulk billed, that means that they're not going to ask for any extra money from your pocket. If you flash that Medicare card in front of them, they will just deduct that from Medicare. They're not going to ask you for any extra kind of money or any extra kind of gap payment there. Accessible healthcare means that it's accessible to all people. Essentially what that means is that if you are an Australian citizen or a permanent resident, I'm not going to say, oh, you earn too little, I'm not going to give you Medicare. Or, you are from a particular, marital background, or you're from a particular cultural background, and I'm not going to allow you to access Medicare. Anyone, regardless of the marital status, regardless of their regardless of their cultural background, regardless of their financial background, everyone, as long as you're a citizen or permanent resident, can access Medicare. That's why Medicare is accessible. And Medicare obviously comes at little to no out-of-pocket cost, which means that usually there's not any extra money you have to pay out of your pocket. You just show the Medicare card and your service is covered. Okay, now what are the services covered by Medicare? So the first service covered by Medicare is obviously GP visits if the GP is a bulk billing. Okay, so if you see that sign in front of your GP that says bulk billing, then that means that that doctor takes no extra money from you when you go for a doctor's visit. Of course, there are doctors who will take extra money. So if you, for example, visit a specialist doctor, someone who specializes in a certain condition like heart conditions, or you visit a private doctor, okay, someone who has their own clinic, who isn't working, you know, with another group of doctors in a big clinic, they've just got their own specialized clinic. These are doctors that will actually sometimes not bulk bill. And what the opposite of bulk billing is that they actually charge what we call a gap fee or a gap payment. Gap payment means that if I go to a doctor, a private doctor who's got his own clinic, who isn't bulk billing, he will still take my Medicare, but then he'll say, okay, that's your Medicare done. Now you need to pay me $36 as well out of pocket. So then I have to grab my wallet and I have to give him $36 out of my pocket. So it's an extra payment there on top of my already bulk billed what Medicare covered. Now, obviously, doctors who bulk bill, they're not going to ask you for extra payment. They're just going to directly take from your Medicare. You don't got to take out your wallet and pay them extra on top of that. Okay, that's what bulk billing means. And that's why most people prefer to go to doctors who do bulk billing, because no one wants to pay extra money out of their wallet if it could be all covered by Medicare. Now, hospitalization, so obviously in a public hospital, if you're going for hospitalization in any public hospital, so Sunshine Hospital, you know, the Royal Melbourne Hospital, Royal Children's Hospital, those are all public hospitals. So if you're going for a hospitalization there, or you're getting some kind of special treatment there, those are usually covered by Medicare. You don't have to pay extra. Pathology tests. What do pathology tests mean? Well, pathology tests are simply blood tests. If you go to get your blood test done at a bulk billing medical center, or you go to get your pathology test done at a public kind of pathology collection center, then obviously that will also be covered fully by Medicare. X-rays, eye tests at participating optometrists, so all of your main optometrists, for example, Specsavers, OPSM, usually all of them are bulk billed, or they cover the entire cost. But when we're looking at, you know, more private optometrists, maybe they specialize in certain eye conditions, that kind of stuff, they might actually charge a little bit out of pocket. Similar to what I was saying before, you might have to pay extra out of your pocket. But the main ones that you find in most of your shopping centers that most of us go to are usually just all covered by Medicare. Now, what are the services not covered by Medicare? So obviously now we've looked at the services that are covered by Medicare, and you need to know at least two services that are covered by Medicare. Now, what are the services that are not covered by Medicare? And you need to know, again, another two of these. Firstly, dental treatments. If you've ever gone to the dentist to get braces or to get a cleaning or to get a filling, you know that dental treatments are not covered by Medicare. They are covered by, you know, you have to pay money out of your pocket. Now, there are exceptions to this rule because the government, obviously, when this first started out, the government realized that a lot of parents are not taking kids to go to the dentist when they're really young. Because it costs too much money. And now as a result of this, kids are getting cavities, they're losing a lot of their permanent teeth, etc., etc. So that's why the government put in this plan called the dental plan. And the dental plan is not, we're not going to say that dental treatments are covered by Medicare just because this dental plan exists, that, you know, each child between the ages of, I think, 5 to 16 or something have $1,000 a year that they can use. That's not actually something that's fully covered by Medicare, for the simple fact that once you turn 20 or 24 or 25, you're no longer on that anymore. So that's only for a limited period of your life that you can access that. Okay, so that's why dental treatments in general, when you're an adult, are not covered by Medicare. You do have to dig into your wallet and actually shell out some cash to cover those treatments. Ambulance services are the same. So you might have heard of, you know, stories where people say, oh, you know, they were charged $5,000 for calling an ambulance, because ambulance services, unless you have a private health cover or unless you have a membership with Ambulance Victoria, will actually cost you money. Okay, ambulances are not a free service. They're not a service that can just you know, cater to every single person. You know, they are priority services, so ambulance services do cost money as well. Acupuncture, physiotherapy, all of those allied health services, so not main health services, but things that you might use on the side, those are all not covered by Medicare as well. and corrective aids. So things like hearing aids, you know, if you go to Specsavers, glasses, contact lenses, all those things are not covered by Medicare. You usually have to pay extra money for that, as well as hospitalizations at a private hospital. So if you're looking towards, you know, not using public hospitals, but using private hospitals, and there are many reasons for why people would use private hospitals, which we'll learn about later in the chapter as well, that is not going to be covered by Medicare. So in the same way that private doctors or doctors who have their own special clinic usually charge extra for your doctor's visits, being hospitalized at a private hospital also costs extra and is not covered by Medicare. Okay, so know at least 2 services that are not covered by Medicare and 2 services that are covered by Medicare. Alrighty, so what are the advantages and disadvantages of Medicare? So for this slide as well, just know at least 2 advantages, 2 good things about Medicare, and 2 maybe not so good things about Medicare, or 2 kind of limitations or weaknesses. Okay, so just 2 from each. So just going through this, obviously with Medicare, we don't have to pay as much for essential medical services. You know, I've read about things like in America, like if you want to give birth, a lot of people resort to home births, to having their baby in a bathtub or in-house, because it's actually so expensive to just go to a hospital and give birth there. Okay, and obviously in Australia, we don't have that problem. We know that if worse comes to worse, we can go to a public hospital and that will be covered by Medicare, and we'll still get a good quality healthcare there. Okay, so that's essentially what we mean by reduced costs for essential medical services. If I, for example, you know, when I was in grade 6, I had to get my appendix taken out because I had, like, you know, an inflamed appendix. So if I wasn't able to then go to a public hospital and get that service, if I was thinking about, oh my God, this is going to cost me so much money, like, you know, you could have had a big impact to your health as a result of that. So that is what we mean by essential medical services, like emergency services, things that you really need to get done and that you can't do any other way. Okay, it's very hard to give birth, for example, at home. Even though home births are popular in a lot of countries, it's not as sterile. If things go wrong, you know, it can lead to a lot of panic. And so a lot of the time, having a stable healthcare system like Medicare gives us is really good, and it gives people a peace of mind. A choice of doctor for out-of-hospital services. So a lot of the time, you know, we're not forced and just given a list and said, okay, these are the only doctors' clinics that you can ever go to, so stick to those and don't go anywhere else. You know, if I want to go to a doctor who is on the other side of town because I've known them for a long time, I can do that. I have a choice of doctor for out-of-hospital services. It's available to all Australian citizens. You know, I don't have to have been born in Australia to access Medicare. Even if I've just come to Australia, studied a little bit and eventually gotten my citizenship, I can actually still access Medicare like that. Like I said before at the beginning, the reciprocal agreement means that our country does have agreements with other countries in terms of what medical services we can access from other countries as well. So if we go to countries like, I think, Sweden, New Zealand, all of those countries, like, we've got agreements there where they can access our health services and we can access like a basic version of theirs as well. Okay, advantages again of Medicare is that it covers all your basic tests and examinations. So unless you're someone who has like a full-blown chronic illness, or, you know, you have a more serious condition, even if you do have a serious condition, the basic facilities provided by Medicare, like doctors and hospitals, should be more than enough to help everyone out. Okay, so essentially all these things that we might need at one time or the other are provided by Medicare. And if you're really someone who is accessing Medicare a lot, going to the doctors a lot, going to hospital visits a lot, there's actually something called a Medicare safety net, which does allow you to have extensive access to Medicare more than the individual person, okay, and allows you to actually access more things from Medicare to ensure that you are in the best health possible. Now, what are the disadvantages? Obviously, if we're in hospital treatments, if I'm going to a public hospital, I can't choose the doctor I want. So if I've been consulted by a few doctors and there's a really nice doctor that I really want to, you know, look over me and to like help me out, I can't say, you know, I want Dr. Catherine or I want Dr. Lisa. I can't choose, okay, with public hospitals. With private hospitals, you can, but remember, private hospitals are not covered by Medicare. Now, obviously, you might have heard when it comes to certain surgeries, there are big waiting lists. Sometimes you can be put on a waiting list for 2 or 3 years to get a certain surgery done, because the public healthcare system, because it's technically low cost, you're not really paying anything out of your pocket extra. everyone rushes to Medicare. No one really utilizes the private healthcare system as much because it does involve you taking extra money out of your pocket to cover the cost. Medicare obviously doesn't cover alternative therapy. So if you're someone who's really into like acupuncture, or you need a physiotherapist, all of those things are not covered by Medicare because Medicare considers them to be extra services that are not essential. And obviously for doctors who don't bulk bill, so if you've got no bulk billing, I'm just going to write no BB here, no bulk billing, Medicare will not often cover the full amount of a doctor's visit. Okay, luckily for most medical centers in Melbourne, I'm pretty sure they do bulk bill, so they don't ask you to pay extra out of your pocket. But depending on where you live, if you're more regional, the doctors might, for example, charge you extra on top of what you've already covered from Medicare. So those are the advantages and disadvantages. Just know 2 advantages and 2 disadvantages. So now we're looking at how is Medicare funded. So obviously we said before that Medicare is not free healthcare. Your parents pay for this. Eventually when you start working, you are going to pay for this through your income, okay? Medicare, just like we pay taxes, Medicare is another tax that we pay. And so Medicare is by no means free healthcare. Okay, how is Medicare funded? So the first thing we have to remember is that 2% of our taxable income is actually deducted to fund Medicare. So think about all the people in Australia who earn over the taxable income, and those people's, each person's income, 2% of that is going to be used to fund Medicare. Okay, the government just doesn't just create money out of nowhere. This money is taxpayer money. Okay, so this is the main way, or the primary means through which Medicare is funded. Now, in addition to this, the government doesn't just want to leave high income earners alone. High income earners are people who earn very, very high incomes. We're talking about like, 150, 200, 250, 300,000 a year. Those are really high income earners. So what the government then does for those people is they say, yep, you guys have to pay. You guys are super rich, so you're going to have to pay the 2%, but you're also going to have to pay us an additional 1 or 1.5% as well. So if you're a high income earner, if you're someone who, let's say, earns $250,000 a year, you will have to pay the 2%, and then you'll have to pay an additional 1 or 1.5%. Now, this is obviously dependent on how high your income actually is. Is it just high, or is it like very high? And I'm going to show you guys a chart in the next slide that actually determines how this is calculated. And the third way in which Medicare is funded is through general income tax. So this is the general tax that we all pay when we earn over the taxable income. Now, the amount of Medicare levy is not set, okay? And the reason that the government can't just say, okay, every single person in Australia who works, we're going to take $12,000 from your income at the end of the year, and we are going to use that for Medicare. It's not fair, because obviously some people might only be earning like $50,000 a year. Some people might only be earning like $40,000 a year. And then you've got people who are earning $250,000 a year. We can't apply the same amount of Medicare levy to be paid to each individual person in Australia, because it has to depend on how much the person earns to begin with, okay? We can't just leave the person lying on the street, taking all their income to fund Medicare and just leaving them with barely anything to look after themselves and their families. So obviously the rule is that the higher the income you earn, the more levy you're going to pay at the end of the day. And remember, levy is just another word for the amount of money you pay for a service. Now, there are conditions to this as well. So if you're a really high income earner and you don't want to pay that additional 1% or 1.5%, and you don't want to be taxed for that, if you take out private health cover, like a private hospital cover with like Medibank or NIB or those kinds of companies, then obviously the government says, yep, you don't have to pay the additional Medicare levy surcharge because you took out private hospital cover. Okay, and we're gonna learn more about private health insurance later in the chapter. All right, so I just want to show you guys the chart. Where's that chart gone? Oh, here it is. Okay, before we go to the chart, I've already talked about the Medicare levy surcharge. The medical levy surcharge is that additional 1 to 1.5%. Remember I said that high income earners, they are asked to pay an additional amount on top of the normal 2%. So you pay the normal 2% Medicare levy, and then you pay either an extra 1 or 1.5% MLS. MLS stands for Medicare levy surcharge, okay? So that's all it means. Remember, a surcharge is an extra cost. So Medicare levy surcharge is the additional or extra cost on top of the Medicare levy if you are a high income earner. Okay, that's the simple definition. So I'm just going to show you guys the chart now, because all this text here just summarizes what's in the chart. So this is the chart for 2017 to 2018. The numbers will probably be the same for this year as well, more or less. So look, if you're a single threshold, what single threshold means is that if you're a single income earner, so you're not a part of a family, you're just a single person. Okay, if you earn $90,000 or less, that's the base tier. So that means you pay 0% Medicare levy surcharge. You still pay the normal 2% Medicare levy that everyone else pays, but you don't pay any extra cost. That is, you don't pay any extra surcharge. It's 0% there, but you still pay the normal 2%. Now, if you're a family threshold, so let's say your mom and your dad combined, they earn $180,000 or less, then that obviously means that they too will pay 0% extra charge. They don't pay any extra surcharge, but they do still pay the normal 2% Medicare levy. That's the normal payment that every other person would pay. Now, obviously, if you're in, the higher it goes, you can see the higher this surcharge becomes. So let's look at a really extreme example. If I'm a single person, I'm not married, I don't have kids, okay, let's say I'm just a single person and I'm earning $140,000 or more as a single person, I am going to be, number one, charged the normal 2% Medicare levy. That's the thing that everyone pays, remember? Everyone will pay that. Plus, I'm going to be charged an additional 1.5% as a Medicare levy surcharge, or MLS. That's the additional. All right, so obviously that's if I earn $140,000 or more as a single person. Okay, let's say you've got, let's say your parents combined, so your parents or your mom and your dad, they earn $280,000 or more. This is a very high income for a family or for a couple, okay? So essentially what that means is that they too would then pay the normal 2% Medicare levy plus the additional surcharge, which is the additional 1.5%. So it's almost like 3.5% of their income in total is going just to fund Medicare. Okay, and the government doesn't feel guilty about doing this because their reasoning is that, you know what, you already earn a high income. Why can't you just spare 3% for Medicare? Okay, so that's what their reasoning is. They think that you can afford it, and so taking a little bit extra from someone who's already quite rich or quite high income earners isn't really a big deal. Okay, so it's supposed to be a fair system in that sense, and obviously tax works in the same way. General tax, the more you earn, the more tax you pay. So that's just how it works. Okay, that's an example. Now, the good news is you don't have to memorize this table, okay? We're never going to ask you for specific numbers from this table. This is simply for you to understand this idea a little bit better and to know the difference between a Medicare levy surcharge, which is essentially an additional cost, and to know the difference between what is the normal Medicare levy, which is the normal 2% that every single person pays as standard, okay, as the normal standard base amount. Okay, so just make sure you know the difference between the Medicare levy, which is the normal 2% that everyone pays, and the Medicare levy surcharge, which is the additional amount you pay only if you are considered to have a high or a very high income. Alrighty, so the last thing that we're going through today is called the Pharmaceutical Benefit Scheme. So the Pharmaceutical Benefit Scheme is this idea that a lot of the time we can't expect that every single person in Australia is going to have a similar income. Some people are lower income, some people are on concession card, some people are on healthcare card, all that kind of stuff. So in order to make it easier and cheaper for for people from these groups to actually purchase medications, the Pharmaceutical Benefit Scheme comes in. And the Pharmaceutical Benefit Scheme, also known as the PBS, is introduced to allow people who are on, for example, a lower income, who do qualify for things like the concession card or the healthcare card, for them to be able to access medications and afford medications, and not simply say, for example, if they're sick, that, oh my God, I'm so sick, I need amoxicillin, but I can't afford it. I can't go to the pharmacist to get it. And so they stay at home really sick and their condition becomes worse, okay? It allows these people to purchase a medication that might normally be maybe $35 for someone who doesn't have a healthcare card or concession card. They're able to purchase it for maybe $6. So PBS, which is the government program or the government strategy for this, allows them to purchase a medication for $6 because they qualify for PBS, because the government recognizes that they are of a low income. Okay, so this doesn't mean you can just go out and buy any drug you want, any prescription drug that you want. It has to be on the prescription list as defined by PBS. So PBS has a big list of all the medications that are covered. Obviously, certain medications, especially ones that are used for like cosmetic purposes, like Botox, or ones that are used for natural, like, just supplementation purposes, those are not covered. But essential medications like antibiotics, like amoxicillin, that you might need when you've got a fever or a virus, those are covered. Okay, so all the main ones that are really important or that are commonly used in Australia are covered under that list. War veterans are also on this list for the simple reason that a lot of war veterans experience something called PTSD. PTSD is post-traumatic stress disorder, and they need to be able to access anti-anxiety and antidepressant medication for a lower cost. And obviously the government recognizes the work that they've done and all that kind of stuff. So that's basically what the pharmaceutical benefit scheme is. Now, unlike Medicare, the PBS is not accessible to all groups. If you're a really rich person or you've got a really high income, there's no reason why the government would say that, you qualify for PBS. And PBS is something that you need to be eligible to use. You can't just go to your doctor and say, yeah, doctor, can you please tick the PBS box on my prescription? Because then they'll ask you, okay, I'll tick it, but first you got to show me that you have a concession card or that you have a healthcare card. And if you don't, then they won't tick that box, okay? And obviously when you give your prescription to the pharmacist, they first look at whether that box has been ticked. And if it says PBS, when you get your receipt at Chemist Warehouse or at whatever pharmacy you go to, the price will match accordingly, okay? And if PBS is not ticked, then obviously you'll still pay the normal $35 that everyone else pays. So the main two differences and two similarities between PBS and Medicare both attempt to decrease morbidity in Australians and give Australian people a general good sense of health and well-being. But the difference is that obviously PBS is only available to concession card and healthcare card holders, people with low incomes, but Medicare is usually available to all Australian citizens and permanent residents, regardless of financial status. Okay, so that's basically the end of the spread. Yeah, so that's basically it for today. All right, so having done that, I'm just going to stop the recording.